Welcome. So I'm live, a little later than usual, and in a very different place from usual. I won't bore you with details, but I had an unexpected change of plan yesterday, so this is the first moment I've had where I could stop and talk to you. As you can see, I'm in a public place. In fact, I'm in on the Peacefield Heath, and you can see behind me the beautiful heath pond. But the reason I'm here, of course, is that this is the fourth in my series of 5 short videos about tips and techniques for remaining calm, keeping in your parasympathetic rather than sympathetic nervous system in preparation for surgery, any other medical or dental procedures, or indeed anything else that's causing you stress in your life. So just to recap quickly, over the last couple of days I've been talking about using our breath, slowing it down to start regulating the nervous system. And yesterday I talked about how we can use the power of our imagination to bring saliva to the mouth, which banishes the dry mouth, which is such a key part of feelings of fear or anxiety. So if you didn't see that, I do invite you to go back and watch that and to practice that with me. Today I'm going to be talking briefly about the ability that we have to use our imagination to turn down pain. I'm going to move around slightly so that you don't keep seeing people behind me. So managing pain through hypnosis is absolutely doable. But I'm going to be honest with you, it doesn't happen instantly. It takes practice and technique. And I've had a lot of experience in this because over the last few years since I qualified, or since I finished my hypnotherapy training back in 2015, I have been using it 3 or 4 times a year whenever I went for a dental hygiene checkup, which is something I have to do regularly due to a propensity to gum disease. So I've been numbing my jaw on a regular basis over the last, 7 years or so. And I've also done a lot of training in how to induce hypnoanesthesia, hypnoanalgesia. So I had those skills. But what's really interesting is that when I've done my training, I often found that I was really unable to bring full analgesia, a complete numbness to my hand. And the teacher I was working with most recently told me, don't worry, your system knows that it doesn't need to right now. If you ever need it in an emergency, it'll happen. And she was absolutely right. So there I was lying on the floor, 2 broken wrists, knowing I needed an ambulance on my own. I've managed to bring my breath down, bring saliva back to my mouth. I'm getting to a point where I can focus a little bit more. And I'm also giving myself very clear suggestions. My hands and wrists are cool, calm and comfortable, comfortably numb, free from all unwanted sensations. Now, I mentioned earlier on in this series that usually to do this we need to take someone into hypnotic trance, but when you're in a state of shock after an accident or something, your subconscious is wide open. So this is why this is a fantastic thing to know, because you can do this for yourself, but you can also do it for someone else. So if you see someone else who's just had an accident, anything you say to them is going to go straight into their subconscious. And this is why, whatever you do in that situation, you keep your messages positive, encouraging. The worst is over. Your healing process can now start. And that's basically what I was doing. Cool, calm, comfortable, free from all wanted sensations, hands and wrists completely numb. And I simply used those phrases along with slowing my breath, along with free-flowing saliva to the mouth, interchanging all those suggestions as I waited to get to a point where I was physically able to crawl into the next room and find my phone. And what's really interesting, because I kept doing this for a long time. And I also had the opportunity, once I got to my phone, to call in some support from a very dear friend who is also a hypnotherapist, who I basically asked to take over, because it's even more helpful when you have someone else saying those words than when you do it yourself. And what I wanted to share with you about the pain was that after, I don't know, maybe an hour of this, I started getting worried because my hand, I could realise that the fingers on both my hands were feeling numb and tingly. It didn't occur to me that I wasn't feeling any pain. I could just feel numb, tingly fingers. And in fact, I was so worried, I rang 999 again to ask them to hurry up the ambulance because I thought there was a problem. When I talked about this with my own hypnotherapy mentor later on, she pointed out that I had simply successfully numbed my hands so well that even my fingers were now numb and tingly. And when I look back, there was no pain. So it is incredible what the mind can do. And there are other ways that we can harness this ability to turn down pain. There's a thing called the control panel, which I don't have time to go into here, which I used when I left the hospital. I refused all painkillers when I left the hospital. I had no need of them. Whenever my wrists started to ache, I could simply turn down the level of pain. And these things are amazing. It's the power of the mind, the power of our imagination to connect to the body. Pain is an indicator that there is something wrong. If you can tell your system that you're hearing that message and it's okay, it is able to let go of the pain. As I say, these things require practice. You can find ways of practicing it yourself. You can talk to me, you can talk to somebody else who's trained in this kind of thing. But they are amazing. So I'm going to leave it here for today. Tomorrow, in the final part of this little series, I'm going to be talking about how I sped up time. So there's a little teaser for you. I really hope you'll be back here to watch tomorrow, either live or on replay. Thanks for watching. Take care. Bye now.